On behalf of TVLesson.com, I'm Dr. Jeffrey Epstein. I'm a board-certified facial plastic surgeon who specializes in surgical hair restoration. In this clip, I'm going to show you how I design a facelift and the different considerations I take into account when approaching a patient that's desiring a more youthful facial appearance. In this case, we have a patient who's in her late 40s. Some of the more common concerns she has is the heavy jowls that she's starting to, that are starting to become more pronounced. She's got the excess skin as well as a little bit of excess fat in the neck. And then lastly, the mid-face, where this cheek fat pad, which used to be up here, has now dropped down, leaving her a little bit of a hollowness in this area. The way I design the facelift is, well, first of all, I'll go ahead and work with the patient, and I'll show the patient, what sort of thing we're trying to accomplish, what the overall look is. In this case, with this patient, we're trying to achieve a smoother jawline so you can see the pulling up. At the same time, when I do the pulling, you also see the elevation that we get in the cheek fat pad. In order to go ahead and design a natural, to get a natural look, I make my hairline, I make my incision through the sideburn so we don't lose much of the sideburn. I then wrap it around the ear, and then in this case, I'm actually going behind what's called the tragus, this little cartilage pointer. And then I'm wrapping around the earlobe, but notice how I'm not going to go ahead and leave the earlobe in a pulled pixie fashion. I'm actually going to leave her with a free hanging earlobe. Then the incision carries up through here, behind the ear, and then down through the hairline. So essentially, just about all the incisions are hidden. Through the use of these incisions, we're able to minimize any scarring and thus have the most natural and unoperated upon look. On behalf of TVLesson.com, I'm Dr. Jeffrey Epstein. Thanks for watching.